Justice Devan sir, and all the dignitaries on the dais and off the dais. I know all of you, irrespective of whoever is sitting here, will have no liking for the six-letter word CANCER. Am I right? Yes. Nobody likes it, including me. Now, cancer is one disease which is happening irrespective of whether you are young or old, irrespective if you are a male or a female, irrespective if you are a rich or a poor person, irrespective of you are a millionaire or a laborer, irrespective of whichever walks of life you are, you're a judge, you're advocate, doctor, nurse, anybody. So irrespective of whichever human being, cancer is one disease which can affect. And it is actually a clown in the normal life of human beings. If you look at the hospitals today, multi-storied 5-star hospitals are coming. Almost 80 to 90% of the hospital beds are filled with 4 different diseases. They are called non-communicable diseases. The number one is heart attack and the cardiology issues. Number 2 is cancer, and slowly cancer is going to overtake cardiology issues. Number 3 is diabetes and diabetic related issues like strokes or kidney issues or transplants, etc. And number 4 is chronic respiratory diseases. These actually are highlighted as the 4 different non-communicable diseases. But of recently, there are 3 other more diseases coming in the bracket of non-communicable diseases, and number 1 is, as Sir said, obesity. And this is a big issue today because almost every disease has got a basic relationship to the obesity. You know, when somebody is obese, what does it mean? The muscle mass is not increasing, the bones are not becoming bigger, but what is becoming bigger is your fat. And fat, excess of fat, is actually a deposit zone for all the hormones that is secreted in the human body. Remember, more than 60 to 70% of all cancers are hormone related. Whether it's testicular cancer, prostate cancer, ovarian cancer, breast cancer, uterine cancer, lung cancer, or any GI cancer, stomach, colon, all are hormone related. The more hormones are getting deposited in your body unused in the fatty tissues, you become susceptible for cancer. That's the role of exercise, what he is told. Our girls are performing Zumbathon. Remember, cancer prevention, the short methodology today is only one, that is physical exercise. You have to burn calories. Unless the calories are burnt, we get the deposit of these things and hormonal changes occur. Because this is not the order in which I was planning to speak, but because of Justice has made a statement of exercise, I want to continue. When you do the exercises, changes does not initially is happening in the lower part of the body or your legs as you think. It happens in the brain. Because neurosecretors in the brain starts slowing down, it starts concentrating onto your positive vibes in the human body. When neurosecretors in the brain starts emitting positive vibes and hormone secretors like endorphin or whatever, that indirectly stimulates the other hormones in the human body like adrenaline or cortisol or so many other hormones into a positive methodology, which means your body indirectly is getting benefited and your mind is changing. If you do a 1 kilometer walking in the morning, you know how much beneficial it is. If you do it 5 kilometers walking, it is much, much better. So with due respect, can I put in a question to you? Any of you today morning have walked and coming sitting here in the meeting? Please raise your hand. Anybody? 45 minutes. So that tells that the value of exercise is the most important thing which somebody should realize. Remember, 40 years of age is a cutoff point in medicine. Most of the diseases, if you take history, 40 years a cutoff point. There is thyroid cancer, breast cancer, lung cancer, esophagus cancer, stomach cancer, prostate cancer, any cancer, 40 years. Up to 40 years you will live to eat. But after 40, please eat to live. If you don't eat food like medicine, after some time, you may have to eat medicine like food. And this is a big problem, not only in Kerala, all over India, all over the world. Now look at, because my point of concern is cancer. You remember that, understand that 25 million people are diagnosed all over the world with cancer every year, new cancer cases. 16 million to 17 million die. And of these 16 million who are dying or who are getting cancer, more than 80% of them live in the third world nations. India, China, Asian countries, Philippines, Thailand, etc. and Southern American countries and African countries. In the rich world, they have got insurances, they have got awareness programs, they have got early detection. It is mandatory for all the health insurance companies, if you live in US or in Europe, that your previous year's health checkup strategy should be submitted if you are diagnosed with cancer. Because cancer is such a common disease today. So that is the importance of cancer. If I ask you how many of you are insured for cancer, I don't know. But that is mandatory today. Because it's like a lifestyle disease. And what is a lifestyle disease? Lifestyle disease is one which can be modulated. And coming to cancer or heart attack, they are all lifestyle diseases. And as sir has said, today our interest and focus is more towards prevention of cancer and early detection of cancer. Our director, Father Volaparbil, Lal Joseph, has come a vision. We are planning for a massive screening and early detection program for the coastal belt and other areas in our district of Ernakulam on a charitable basis. That is to understand the statistics and to know the details. When Panchayat wise we are planning for the program. That will be our agenda for the coming years. So therefore it's important. Then you may ask me a question, doctor, how can you prevent cancer? Remember, a vaccination can prevent cancer. Human papillomavirus creates cervix cancer. If girls are vaccinated by the age of 14 to 17 years of age, you prevent cervix cancer. And India's, before independence, the highest number of death among women in India was because of cervix cancer. Tata Memorial Bharti Center has proved that just personal hygiene like washing after sexual intercourse can prevent cervix cancer, because you are preventing a problem which is existing in that village areas. So the breast cancer has become number one, and that is the issue because young age cancers. Yesterday I saw in my OPD 25-year-old girl coming with breast cancer. She said, I never believed that my swelling is cancer, so she waited for 2 months. And remember, any cancer appearing in younger age, which is common for the older age people, they are all having lifestyle as a factor and genetic impact also a factor. When I asked more about the history to her, her father came out and told he had colon cancer at the age of 40, about 10 years ago. Which means today many cancers are run in families. So genetic testing also is very important. Coming to prevention, as I said, a vaccination can prevent cervix cancer. Remember, Australia, New Zealand, and many European countries, boys are vaccinated against HPV virus. Today is the era of homosexuality, oral sex, then promiscuity and rampant. So boys are getting vaccinated because throat cancer, non-tobacco induced throat cancer, commonest factor is HPV virus. So this is a big social issue today. So prevention is possible. And so many diseases can be prevented. All of you know most of the cancers, tobacco is the main causative factor. If you stop tobacco itself, head and neck cancers are reduced or prevented. Alcoholism, it is proved now beyond doubt that excess of alcohol can create issues in cirrhosis and then further cancer. Coming to the fourth lifestyle is the issue in the liver we call fatty liver. What is fatty liver? Remember, the only factory in the human body which can synthesize things is liver. There is no other organ. The only organ in the human body, if cut, can regrow is liver. There is no other organ to that style. So therefore, if liver, which are factory cells, are getting destroyed with the fatty infiltration, that means slowly that becomes cirrhotic. If cirrhosis, the next step is called cancer. So that is called non-alcoholic fatty liver. Obesity is the number one factor. Lack of exercise is the number two factor. The last lifestyle disease I would like to say is, thanks to IT industry, which is booming in India, chronic back pain and chronic shoulder pain because of the posture in which you are doing the work in IT industry. That is a new lifestyle change disease. So coming to the point of cancer, this is a time when we have to be awakened to understand that it's a preventable disease. 80% of the cancers are preventable, can be detected in the early stage. If a young girl or a lady comes with breast cancer, I am as a cancer surgeon and an oncologist, I never advocate anybody undergoing mastectomy which is demoralized or destroys the morale of the person. And today everybody is working population. You can understand a woman going without a breast, how much psychologically there is a problem. As an oncoplastic surgeon, I always do a breast preservation or a plastic surgery job. So similarly, all the cancers, life, quality of life is the issue. A child coming with a bone tumor, gone are the days of chopping his or her leg. We preserve the leg and treat the cancer. So that is the modern methodology called function preserving cancer surgeries and other treatment. We want to offer good quality of life. If good quality of life is to be offered, we have to detect the disease early and treat the disease early. So the whole agenda or planning is changing in the world altogether. I don't know anybody of you have read yesterday's, 4th of February's Indian Express. My article is here on how to cope up with cancer. Coping with cancer, as I said, is a big issue today. Psychological trauma. See, the first question anybody will tell themselves is, why God or me? Why did not happen to the next person? That person is smoking the same style I am smoking, but he did not get cancer, I am getting cancer. Remember, cancer is multifactorial disease. It is just like a fertile land where you are sowing seeds for paddy. The soil has to be prepared well. Similarly, the human body should be receptive for a carcinogen. Any agent that can cause cancer is called carcinogen. Can be chemical carcinogen, physical carcinogen, atmospheric carcinogens, or your dietary carcinogens. Any carcinogen, an agent, is called a carcinogen. Just like seeds you are sowing. Just because you sow the seeds in the paddy field, it will not grow. Birds can come and take it away. Similarly, in our body, if you walk behind a KSRTC bus, you can get cancer tomorrow morning because of the pollutions. That is not happening. Why? Because our body has got killer cells. And these killer cells are monitoring our body every now and then 24/7 to remove all the deleterious agents coming into the body. And today, that has come as a field in medicine called immunotherapy. We are changing our killer cells in such a way it can go and attack cancer cells and destroy and give us a good life. That's called immunotherapy. The new system has come in the medicine. So world is changing. Oncology field is changing because it has come a household name. Can you tell me, see, at least one person sitting in the crowd who has got a friend or a family friend or somebody known to you without cancer or not heard about cancer? I'm 100% sure that is not so. Everybody's family or everybody's friend circle, somebody is affected today. When we were students, way back in end of 1970 and early 80s in Medical College Trivandrum, of 200 students of us, we want to present a paper, a case history to the examiner of a cancer. We were hunting in the wards to get one patient. And remember, an unfortunate lady coming with a breast cancer, somebody coming with a thyroid cancer or a tongue cancer, had it because 200 people will go and examine that person because we don't get cases. And not only us batch, the senior batch, junior batch, everybody will go and palpate that breast. And patient will run away after that. Today, on the contrary, every ward is filled with cancer patients. So cancer is not an unknown thing. That is the difference that has been created. What changed the Kerala's lifestyle, Kerala's the system to have maximum number of cancers in India, the most thickly populated place. lifestyle changes first happens in Kerala because all are rich, poverty is gone, technically speaking. Gulf boom has created more money to Kerala. So somebody who was having a bicycle bought car. So lifestyle change, bicycle gives you exercise, car gives you freedom and pleasure in traveling. Things slowly change. Those who were eating kappa, kanji and chakka were eating porota and meat, and the whole food habits change. So remember, every disease in the human body, everything starts with one word called inflammation. Anything, heart attack, cancer, viral diseases, bacterial, everything starts with inflammation. Inflammation has got color, rubber, dollar. These are the terminologies. A cell getting inflamed will be removed by a killer cell, but it can remain and multiply. That inflammation process starts for heart attack because calcium gets deposited and the blood vessels get blocked. The same inflammation causes cancer. Just chronic inflammation of the uterine cervix produces cancer. A chronic inflammation in the gastrointestinal tract can lead into cancer. So inflammation is the process. In bacterial infection also it is inflammation. So therefore these diets create this issue. When you eat parota, it is very tasty. But how many of you know to make a brown colored wheat flour into a sparkling white colored maida, how many chemicals are added? Benzene peroxidase is added to make it maida. And that is our staple food. Kerala's staple food means parota and beef curry. You eat, but then your vegetables must be plenty with you to remove all these waste materials. One more last word I want to tell, that our diet is the causative factor for increased incidence in cancer in Kerala. Colon cancer, stomach cancer, breast cancer, uterine cancer, ovary cancer, everything has got a relationship with our food and indirectly to the hormones. So dietary changes are mandatory to have a prevention and of this cancer in Kerala. It's a must. And food that are helpful to prevent inflammation. And the best example I can take is jackfruit. I'm a promoter for this jackfruit flour and jackfruit because this is a miracle given by God. So many antioxidants, so much of protein, so much of cancer preventing agents like jackalin, pectin, everything is rich in this fruit. I'm not telling about the chakkapadam, but the raw, mature jackfruit. It helps. My studies there on cancer chemotherapy patients receiving jackfruit flour and preventing the chemotherapy toxicities. So we have to understand lifestyle means everything. Your exercise, your diet, your sleep, lack of anxiety, all these things are mandatory. So prevention is better than cure. Coming to our girls performing Sumbathon, I am told that Justice D.R.Thomas is an ardent fan of dance. Am I right? Because somebody on Facebook wrote to me when my post was there that, oh, D.R.Thomas is performing and he came to inaugurate some dance programs in our...
I danced to my wife's tunes.
Maybe. But anyway, that's a good thing that many of the men has to dance after the age of 40 with wives' tunes. Because otherwise they cannot get... Children all go away and they are all alone. They have to. Otherwise life will change. Anyway, they are performing dance because it's to give you an idea that exercise does prevent cancer, and the best exercise will be always brisk activities, including a Sumbathon. Thank you very much for your patient hearing. I know it's this time, your lunch time and all. I won't be able to speak. If I give an opportunity, I can speak for an hour or two, but this is not the venue for that. Thank you very much. So, God bless you all.